you have to just be purposeful. You have to be intentional about your studies and being disciplined to get to the next step. Going to dental school was my goal, ultimate goal. Getting out and being the first to do something doesn't always give you the advantages you think you're going to have. And I ended up closing that practice and I ended up moving.
Good afternoon, Wealthy Dentist Podcast members. We want to let you know that we have Dr. Zina Berry with us. She has 25 years of experience and the founder of Z-Loupes, a serial entrepreneur, and is the recipient of New York State's Champion of Innovations. She created the first smart gesture control surgical loop to eliminate occupational pain for clinicians. Help me in welcoming Dr. Zina Berry. Dr. Berry, how are you doing today?
I'm doing great. Thank you for that wonderful introduction. I'm not sure if I can live up to it, but I'm going to surely try.
I'm sure you will. There's no question about it. I have no doubts about it. You've been pretty busy. So
a little bit.
Yeah. So let's start off in the beginning. How did you wind up getting involved with dentistry in the first place? Why? What interested you there? What made you jump into that business?
You know, as a child, I really enjoyed art and I was very creative, and it was a gift that I got from my mom. And I really wanted to do something in the art arena. And so I was like, I want to be an artist. So my mother said, oh, you know, artists don't make any money or become famous and that they're dead. And I was like, well, I don't want to do that. So I pivoted pretty quickly, like, no. And you know what? The dentistry kind of resonated with me. When I used to go to the dentist myself, unfortunately, I had a grandfather that gave me a lot of candy. So I had a lot of occlusal cavities. So, you know, I started out with the dental office pretty young. And, you know, I think I was about 11 or 12 or so. And I went to the dentist. And, you know, this is during a time when you can actually go without a parent. You know, you ride the bus by yourself, you go to the and you take yourself back to school. Okay, those days, right? Mm-hmm. And I remember sitting down saying, you know, I want to be a dentist. This looks exciting. And the dentist that was treating me said, well, I think you're better off, you know, being a hairdresser or a school teacher. And I remember being taken aback by that, like, really? So I went home and I said, Mom, you know, I talked to the dentist, but he told me I should be this or that. And she was like, no, you need to pursue whatever it is you want to do. So if that's what you want to be, make that your goal and go after it. And I think my mom was the first person that taught me goal-oriented processes and how to go after them. And I didn't really realize that's what was happening at the time. Trust and believe. That was not in my mind. However, she was correct that you have to just be purposeful. You have to be intentional about your studies and being disciplined to get to the next step. And those aren't always easy.
Yeah. Wow. It's always good to have someone around with the wisdom similar to your mom's. I mean, tell you that always go, you know, years and years into the future of thought, you know. And like you said, it doesn't hit you right there, but somewhere along the line in your life, you says, my mother told me that.
Exactly. You know what? You don't go back and put the pieces of the puzzle together until you're far down the road. Then you're like, wait a minute. I got this from back here. I didn't get this on my way. This was put into me before I even got on my journey. You know what I mean? Yeah, so she spoke that into existence.
So you got yourself involved with school. You got yourself out and you start dentistry. Did you start as an associate after you've completed your work with school?
No.
Okay. So how did that work out? What?
Yeah. So, you know, going to dental school was my goal, ultimate goal. And getting to that goal was great, right? You know, you kind of race towards it. But then during my senior year of dental school, I realized what was going to be my next step. You know, I didn't come from a family of dentists. I didn't even really know any dentists or whatever. So I had to start trying to figure out what was going to be my next step. Mm-hmm. So I decided to try to find a dental office or a practice that kind of resonated with me. And I talked with one of my classmates who was actually in the medical school at the time, and she had a dentist back in her hometown that was retiring. And so she was like, well, why don't you come home with me? And this was in Middletown, Ohio. And I decided, okay, I'll go. And I did. And I went and saw the practice and I decided to purchase it. Unfortunately, the dentist had passed by the time I graduated and was able to make the acquisition. But the surviving wife actually made the deal and I went forward. So it was, that was a great opportunity, so to speak, until I got into the practice. And this is one of the lessons I had to learn that, getting out and being the first to do something doesn't always give you the advantages you think you're going to have. Right. And so what I mean by that is after I got into practice, I started recognizing that there were some practices that I couldn't continue. So patients would come in and they would have insurance and they would say, oh, I never paid a copay or I never paid anything. And I was like, wait a minute, your copay says this and that. You know how we're not taught the business knowledge in dental school. So I just was pretty much going by the guidelines. And so what I had realized is the dentist that I had taken the practice over didn't charge any copays. And so that was very difficult to overcome. He pretty much let them pay with their insurance and then that was it. So, but it also held me back in other areas where I had to strain to try to look and find my procedure. I always didn't have the light where I needed it. A lot of adjustments, a lot of touching, trying to get it right and things like that. And then as you mature in your career in that journey, I didn't end up buying another pair, and then you buy another pair. I probably bought about 3 or 4 pair before I retired. And there was a couple things that was very consistent that I realized. One, the battery pack was always having to be belt worn. And then 2, the equipment was heavy and it really didn't fit me. Like I have a small face, the glasses were huge and bulky. It was just heavy equipment. And after dealing with neck and back pain, I realized that the equipment wasn't working for me. So I wanted to create something that was going to work for me and other clinicians. Smaller frames, giving you lighter weight, giving you another battery option, and then nailing the fact that you now have a infection control process, even when you're wearing your loupes. So with the loupes, with Z-Loupes, you don't have to touch them to turn them on. You don't have to touch them to increase or decrease your illumination. All that is done with a hand wave. That's all you do. You never touch them. And now we have another option as far as the battery pack. The waist battery pack is one. Now we have a neck battery pack. The neck battery pack can be worn around the neck. It's ergonomically shaped where the bulk of the weight is on the back and the rest of it is on the front and the soft paddles, and it fits right underneath your lab coat. And so when you hook this up, you're ready to go. No one really sees it. The cord comes out on the side so that it actually fits into your gesture control on the side here. You don't ever have to worry about it. However, with Z-Loupes, the Z difference is the fact you get 2 battery packs. Not only do you get this neck battery pack, you get a waist battery pack too. Because I don't want to exclude anyone. I want to be inclusive of everyone. So if the neck battery pack isn't your flavor of the day, you have your waist battery pack. But the way I have used Z-Loupes, and when I was developing it, I would use my neck battery pack for my morning surgeries because it was the lightest, it was the most comfortable. And then in the afternoon when I did lighter work, which was restorations, crowns, and things like that, I would put on my waist battery pack. So it gave me the option that I was looking for. And I'm hoping that, and I pray that I have solved these pain points for other practitioners as well.
So tell me, Dr. Berry, we back up a little bit. I want to know, exactly what pain points did you have when you didn't have the Z-Loupes? What were you hurting? I know you said neck, but
flexure point of my neck, extending my neck forward because the equipment was heavy. And remember, they're fixed. The loupes that originally came out were not ergos. So the ergonomic deflection is a 45 degree. that allows you to sit straight, have your spine and your neck in alignment, and you look straight out. And the deflectors actually deflects them down. So when you actually are wearing loupes, you have a deflector, and those deflector actually are your 45-degree position. So when you're looking out, you're looking straight. It deflects you down. So you don't have to find the procedure anymore. The procedure now finds you.
So is that AI?
So when you put these on, they actually fit. You can see all you have to do is wave the gesture control to turn it on, increase or decrease your light. And this is 3.0. So our magnifiers come in 2.0 all the way up to 5 for the price of $4,100. If you want anything above 5, it's $250 more because the prisms with higher magnification cost more. So 5.5, 6.0, 6.5, all the way up to 8.
So the wave of your hand creates the adjustment that you need to have to see your patient.
Yeah.
Wow, that's magical. So, is it AI directed, or how does this work? I mean, how does this machine knows that you want to project out, project this way, that way, left, right, center? How does it know that by waving your hand?
Right. So the sensor that's inside of the gesture control, that sensor will detect the wavement of movement. And so the sensor has a movement that goes back and forth. The sensor knows to turn on and off. When you take your hand in a static position and you move it away from your body, the sensor knows that now we need to increase illumination. When you have gotten your illumination wherever you want, you just drop your hand. So if you want to change your illumination, you bring your hand up. It doesn't matter where you are. Bring your hand back up. You just close your illumination back down.
Wow.
So you don't have to touch it. You can work. You got the freedom to work.
So does the camera go out, forward, and backwards, or does it?
There's no camera. There is no camera. There's just a sensory. That's all it is, a sensory. And the sensory is attached to the side of the loupes themselves.
Okay. So the battery, waist battery, neck battery, are there any health concerns for the dentist that has this battery pack on their neck and around their waist?
Nope. So the battery pack is inside of the neck battery pack. And like I said, these are paddles. So these are very soft. And that is so that the doctor can have flexibility as far as size, take it in, take it out. And the battery pack is in here itself. So it's the same kind of battery pack that you wear on your waist that you put here. It has no radiation. There's nothing that's going to hurt you. It's just a battery.
Okay.
So when you put this on, it's lightweight. It weighs like 3 ounces. It's not heavy. And so when you're wearing this, like I said, during the daytime or the morning session, the evening session or whatever, the light stays, the battery life is active for 4 to 6 hours. You have to charge it per day, but it stays active that long.
So it's lighter than a phone.
Mm-hmm. Yeah. Let me show you how I can't balance my phone on one finger. You see, that's much heavier but I can balance this neck battery pack. No problem.
Yeah.
So you can see the difference.
It looks like. It does. Right. You're right. Yeah. Right. I can tell the difference in weight just by watching your hands. Okay.
Yeah. And you see the glasses I have on today, right now? Yeah. These are the kind of glasses you can choose from for Z-Loupes.
Okay.
So we have boutique styles frames, fashion forward for male and female.
Yeah.
And the way that this works is a little different than other loupes industry, is that Z-Loupes allows you to do it right from the comfort of your home. So say if you like what you see and you want to get a pair of Z-Loupes. So you go to our website, you sign up, we will contact you in regards to what you're looking for, male or female, what kind of frames you're looking for. We will mail you out a kit that has about 5 frames in them. You get them at your home. We have the frames, we have the Doppler, which is the measure for your interpupillary distance. Okay. So the end user experience that the doctor will go through is to make sure that they're interested in Z-Loupes and we contact you. Once that contact is made, we mail you out a virtual kit. The virtual kit is so that you can have your appointment in the comfort of your own home. If you want fashion forward male, or you want fashion forward female, or you want a combination, we send a kit out to you. We have about 5 frames for you to select from. You get to decide on your color and your style. After that, we have a measurer, a ruler that's in the box that helps us obtain the interpupillary distance. The optometrist that you schedule with does all of this with you. It takes about 30 minutes. And when you're done, you zip up your case and you mail it back. When you mail it back, it triggers your order. And then your order will be received between 6 to 8 weeks.
So all of what you sent them, any extra information or extra materials that you sent them, they send back?
Yes.
Okay.
Yeah.
Okay. And then you said there's no touching, because I saw there's no touching. And talk to me again about how, the whole health transfer of, any germs or anything like that.
Sure.
Is minimized.
Sure. So with the gesture control, it is minimized because you're not touching your loupes throughout the day. Okay. Once you put these on, you have them in position where they're comfortable, and you turn this little dial on, you're done for the day as far as making sure that they fit. So when you put them on, and they rest on our chest when we're not working, right? And then when we put them on, all you got to do is just turn this on and you're done. You work through your procedure, you make your change, you turn it on and off. Your assistant doesn't have to reach over to try to help you adjust anything, because now we have that remote already set in place. So I feel like what I'm trying to do is make sure that that worry is now removed.
Wow. What makes Z-Loupes so special compared to the old loupes?
So Z-Loupes compared to the industry standard today, we have the main differentiator being that we're the only ones that have it, and we are patent, is the gesture control. The gesture control is a fully functional gesture control. You do have other gesture controls that are on the top of the loupes themselves, making them heavy. Yeah. You got to touch it. You got to touch it. You know what I'm saying?
Okay, that's it. Right.
Well, and even if you have to touch it before you put them on, right? You touch it, put them on, but that sensor, if you wave across it, it'll turn it off. So that is the biggest difference with Z-Loupes, is that our gesture control is stable. Somebody can walk by you and it's not going to change. So the only way it's going to change is you have to be this close to your temporal to get it to change. All right. The second differentiator we have is the neck battery pack. Our neck battery pack is ergonomically shaped around the collarbone. You got flexible, wings to make this such that it's not too tight, it's not too loose. And the battery pack is on the back, which is on the back of your neck, giving you the counterbalance. So that is all that is different than what's on the standard today. The last thing I would say is that I don't know. I'm sorry.
Go ahead. No, I'm excellent point.
Okay. And the last thing is the fashion forward frames. Having really boutique style frames for you to choose from, not just your ordinary, plastic polycarbonate, frames that you're putting on. Let's spice it up a little bit. Let's be on the fashion forward movement.
Working style.
Yeah, exactly. We don't need to be boring. We don't need to be boring.
No, not at all. So tell me then, now that we have the differentiators covered, I wanted to know how long has Z-Loupes been out? How long have we been using
the Z-Loupes was created in 2023. So we're 2 years old.
Okay.
And I started this process when I was still a wet finger dentist. And then I retired to fully immerse myself into the product of Z-Loupes, because this is a lot of work. a lot of things that you have to do. I'm not an engineer, but I'm working with a lot of engineers. However, they don't know what I know as far as the dentist and the medical device that I'm trying to create. So it's a lot of communication, a lot of collaboration, a lot of data search, a lot of surveys done, so that we are not just making something that fits Dr. Berry. I'm making something that fits the community of medical professionals, not just dentists, medical doctors as well.
Oh, wow. Surgical. They do surgery too, right? So,
Exactly.
yeah. Okay. So, wow, this is interesting. That brings on a few other questions because I'm thinking that, now you have to work with engineers. You got to work with people that's going to patent what you're trying to create, and that's after the engineers have put it together. I don't know what you said you draw. Your mom, I don't know if you hired your mother to draw anything for you, but man, I see a lot of intense work going on here behind the scenes. Before you even put the product on the market, there was a lot and we're not even talking about the governmental processes and loops and hoops that you have to jump through to get to where you want to go once you got everything put together. I mean, you still have to go through the government to put this out there. So what happened there?
So, what happened was I was drawing out my idea with a neighbor friend of mine across the street from me, and her son happened to walk in, and he's an engineer. And that's how it developed. And he's a minority partner in Z-Loupes. And he and I decided from that point on, hey, you handle the engineering part, I'm going to handle this over here. And we came together. And that's how we've been able to, divide and conquer, if you will. Because I don't know the engineering terms, but I do have somebody that understands what I'm trying to accomplish. He has the engineering background, so we're trying to make sure everything we do, we test it. We're making sure we ask other people, we canvas other people, and then we test our subjects too. So we've had dentists to test us out. How does it work? How do you like it? And they do like it. And we just started selling Z-Loupes. So we went on the market last month. And I started at the Restoration Project with Dr. Hazel Glasper. And then I followed up with it at the Do Retreat, which is Dental Entrepreneurs for Women. And that's how, I actually came to the Wealthy Dentist because of a networking contact. Her name is Dr. Julia Jackson, introduced you to me. And I looked you up and I was like, oh, there's a whole community of people I can talk to that not only understand the dental world, but understand the fact of connectivity through networking is so vital. It's so vital to our work. It's so vital to our community. And it's so vital to us being able to connect with one another. So thank you. Thank you, Doctor. I appreciate it.
I'm happy to be a part of this because, this is the exciting stuff. I mean, when you talk about, science is one thing, but creating that science so people can actually see it is all of this head work that you have to do to get this information out to the public is, to think about that is just it's got me kind of my head spinning. So I can imagine to some degree what that work was like. So did you have to draw your fixtures in order for people to see exactly what you were talking about? And I know you said you had this engineer neighbor that really helped you with with that process. Were you all together, sitting down with some kind of designer that happened to put this thing together? So how did all that work out? Talk to me about that.
Yes. So he and I decided we put it on paper. It was actually literally entrepreneurship from napkin, pencil napkin to proof of concept. Okay. So, I went to an engineering firm. We, pitched our idea, and said, hey, can you give us a quote? What is it going to cost? And this is what we're trying to do. And I think I went to 3 different engineering firms. And it's just a rule of thumb in business, right? And running a dental practice, you're not going to run any other business any other way. It's the same thing. It's just a different product.
Correct.
So with that being said, getting that understanding of the product and getting to the next step was that getting the camaraderie from others is what helped do that. Getting the engineers to know that the stepwise process of the net battery pack, the just control, those were like 4 different projects that came together. So divide and conquer was the engineering part of it. But for me, I needed to make sure that our working distance, the magnification was correct. Where do we put them on the lenses and things like that? Working with the optometrist. That's where I spent most of my time. Pitching to investors is what I have been doing. I have investors. I actually won investment money through a program called Launch New York. I'm so grateful to have that investment, and other investors are jumping in too. So Z-Loupes is on the move, so hurry up and jump in. Don't miss out.
Absolutely. That's great. This is wonderful information. So, is there anything that we missed that you'd like to help the public to understand? I mean, this is new to me, so I mean, you help us out here.
I think that once this really takes off and doctors and hygienists and other medical professionals can see what it does, it's going to change their expectation of infection control. It's going to change how you feel about it, because before you dealt with a compromised process that you didn't even know that was compromised. Now you have an option. You can close the infection control chamber. The other thing that I think helps is that just making sure that we address the entire market, not just one sector of the market. So females, we're in dentistry, and actually we're capitalizing on dentistry because the membership or the classes going into dental school are majority female now. They're 60-40. Whereas when you and I went to school, it was the exact opposite, So we need to be inclusive of everyone. And that's the thing that I'm trying to change, making sure I include everyone in my design. Not just females, it's males too.
Yes. This has been quite the eye-opener. I mean, I'm just blown away. This is information that just blow your hair back, as they say. And I am so happy that again, that we're part of helping this come out. I mean, you already did it, but I mean, anytime you want to come back, you can come back and talk about this some more, because we really appreciate. I mean, the whole idea of you creating what you've created and spend all the time that you have. I can imagine all of the time. I mean, something like this had to, what kind of time you actually spent creating it is just mind-boggling. You're always welcome.
Oh, thank you. Well, let me tell you how you can find me.
Please.
So Z-Loupes, Z-Loupes is www.z-loupes, LOUPS.com. And we have a 25 early founders page that you can sign up for, and you can get a discount on Z-Loupes. So if you jump on over to that page and sign up and leave your information, someone will reach out to you from Z-Loupes. Thank you so much for this impressive moment that you've given Z-Loupes. I am so grateful. Thank you.
No problem. You're more than welcome. Thank you so much for joining us, Dr. Berry. We want to bring you right back.
Okay.
Sooner than you think.
Okay, no problem.
The Wealthy Dentist podcast is built on connections, opportunities, and meaningful conversations that help jumpstart careers